Nutrient deficiencies. So now we really switch from most of those we can really determine based off of the subjective experience, the symptoms, whether or not someone has some of those deficiencies, to labs. Okay, so I say I have found that nutrient deficiencies are best identified in laboratory tests since there is an overlap in symptoms. So this generally means that if someone has these symptoms, it can be caused by a lot of different things. So we really need the labs in order to determine whether or not these are causes that we need to address. So B12 deficiency, fatigue, depression, anxiety, insomnia, neuropathy, so nerve pain or dysfunction, cognitive issues, brain fog, memory loss. So very important in all of these, but plays a role. As you can see, as we're kind of going through this, and as we've talked about, when people come to see me and when they have fatigue, they have 15 nails in the bottom of their foot. And we can pull out the B12 nail, but it's not really going to make that much of a difference until you pull out the B12 nail, the thyroid deficiency nail, the mold nail, the adrenal deficiency nail. So as you're removing these causes, all of a sudden you're getting the nails out of the bottom of the foot and the person starts to feel, but it's this combination of removing all of these causes that really takes people to the next level in their energy and their health. So laboratory tests to do is that Fix Your Fatigue blood panel in blood, or the urine test, the optimal nutrition evaluation, the ONE or ONE test. Now the laboratory data is going to be B12 less than 1500. This is in blood. The homocysteine greater than 7, also in blood. The MCV, or the mean corpuscular volume, this is the size of red blood cells, also in blood. Or MTHFR, heterozygous or homozygous for one or both copies. So this is a gene that utilizes B12 in order to make homocysteine. Or to make methionine, rather. This is called methylation. And this pathway, oftentimes if you have these genes, you need more B12 and folate and some of these intermediates in order to help with your detoxification process. So this can be a big problem for people. So this is definitely something to look at. Now, the optimal nutritional evaluation will just have it as a urine value that'll say high need B12, or basically severe deficiency of B12. So in my experience, it is very likely that someone has B12 deficiency if they have one or more of the above symptoms and low B12, high homocysteine, high MCV per the above values. If someone has MTHFR gene or other genes associated with methylation, they should receive supplemental B12 as well. But pretty much all the time, if you have a SNP or a single nucleotide polymorphism, or basically a problem with one of these genes, you're also going to have problems with these as well. And when we go more into the course, we're going to talk more in detail about some of these pathways so that you can understand how homocysteine plays a role. And what's very interesting is that homocysteine, when it's above 7, increases risk for heart attack, heart disease, stroke, and Alzheimer's. And so you can see how important B12 is in playing a role in those things, because it will lower homocysteine. And then you come down here to conclusion. Mark off your conclusion, and if it's a yes, add it to page 2.